In this video today, we're gonna be talking about pickle elbow. What the heck is pickle elbow? Well, it's elbow pain that comes from pickleball. We'll get into how that happens. We're gonna talk about the reach 3 R's. That is reset, restore, and then reinforce. We're gonna reset the joint. We're gonna restore normal soft tissue motion. And then lastly, we're gonna reinforce it with a really good exercise, and not only exercise the elbow, but the entire shoulder and core, because the elbow does not work in isolation, so we wanna make sure we're training the entire body. Hey, I'm Dr. RJ Burr of Reach Rehab and Chiropractic Performance Center. We're a we're a muscle, joint, and nerve pain clinic, but we also make helpful health and fitness videos so you can feel and perform your best. First of all, what is pickle elbow? Pickle elbow is basically pain in the outside of the elbow. Really, it's called lateral epicondylitis, or it can be a tendonitis, and it's called pickle elbow because people that play pickleball that develop elbow pain, well, pickle elbow, right? It used to be called tennis elbow, which that's a term for lateral epicondylitis, but when you're playing pickleball, it's easier to call pickle elbow. No more than that. But it's actually how it happens is very similar to, say, tennis elbow, but we want to make sure that we are fixing it the right way and that not just putting Band-Aids on it. Most pickle elbow is due to overuse. You start something new, or you play a lot of matches, a lot of games, and over time you can just develop some overuse, wear and tear. That happens. But if you're scaling your activity and you're giving yourself time to rest, but yet that stubborn pickle elbow keeps coming up, we want to address it more directly with some specific strategies using those reach 3 R's. First one is elbow joint reset. So typically when we have an elbow issue, we tend to lose range of motion in the elbow joint, and typically an extension where we can't straighten it out. So if you have pickle elbow and you compare both arms, if you have 2 arms, right, and you straighten them out and you feel like the affected arm doesn't straighten all the way, this will very likely work for you pretty well, okay? So what we're gonna do is a repetitive elbow extension exercise. So my right arm's the pickle elbow. So all I'm gonna do very simply is I'm going to straighten the elbow, right? If that's a little painful, then just kind of touch it there and come back, right? Get an idea of where you feel that pain, and we're gonna rep it out. We're gonna do about 20 reps or so. And if you start noticing that joint range of motion getting easier, that's a really, really good sign. If you can start to straighten it all the way and it feels okay, you're gonna add a little bit of a whip to it, like this here, within tolerance. We wanna do that for 20 repetitions, and we wanna repeat this 20 repetitions at a time throughout the day, so about 5 times a day. So 20 reps 5 times a day, and let's give this about a week or so. You're gonna hit about 100 reps a day, so 20 by 5, all right, of just this elbow extension here. Good. All right, for the second R of restoring soft tissue motion of the elbow, what we're gonna do is take a common household utensil like the back of a fork, spoon, or a knife, and make sure it has kind of a broad, non-sharp end here. And we can use this to actually work the soft tissues of the tendon at the top of the elbow, or the extensor group of the forearm. All right, so you wanna take a little bit of lotion, pop it on there because you don't want to rub the crap out of your skin and give yourself a little friction burn. So I'm going to put a little bit of emollient or lotion on here. And I'm simply going to take that butt end of my spoon I have here, and I'm just going to rub or scrape through the top of the tendons here. Now the tendons I'm looking for is if you say throttle the motorcycle like this, you can see the muscle pops out here. I'm trying to get this stuff here, and really if you have pickle elbow, you'll know where to go. It's where the painful spot is. So I'm first gonna start by gently just rubbing through the area here and finding some knotty spots or some sensitive spots. And as it starts feeling okay there, you can dig in a little bit deeper, getting into the grooves of the muscles, tendon, fascia, all that stuff. All right, once I've got that, we're gonna add a little bit of motion with it. So what I'm simply gonna do is throttle the motorcycle and then bring the wrist down. So slow and controlled, I'm gonna throttle, work through that contracted muscle, and then relax it and push it down, lengthening the tissue. And I'm just working through the tissues in a nice and easy pattern. You can move through between going small, kind of deep strokes, or say short, fast strokes, and or working through long, broad strokes. And you can just do a mixture of the two would probably be the best recipe here. Work this for no more than say 2 to 3 minutes max. And then after that, we're gonna go into the next R, which is reinforcement, which is an exercise to try and put all this stuff together. All right, now for the last R, reinforce. This is the exercise that's gonna put it all together. Now we're gonna focus on the entire kinetic chain. Now the elbow does not work in isolation. A lot of times the elbow gets overstressed, commonly due to a lack of shoulder stability, maybe poor movement in the hips, because if you're trying to swing at a pickleball and you don't move well through the hips, stabilize well in the core or the shoulder, you're gonna put a lot of extra stress on your forearm. A lot of times you'll get really wristy to try to create more power, which is not great because it puts stress on the elbow, but also probably you have a lot of errant shots if you're getting wristy. So we wanna work the entire body, specifically the shoulder, to make sure we're stabilizing well as a foundation for the elbow. So what we're gonna do is get into this position here called an oblique sit. So I'm gonna go in a side sit position. My elbow's underneath my shoulder. My arm is straight ahead, not way out here, not in here, straight ahead. My knees will stay stacked in a semi-bent position, so I'm a little bent in the hips, a little bent in the knees, right? First things first is that we don't wanna be in this slouchy, like sexy beach pose position here. We wanna pull that shoulder away from the ear like this so that our torso straightens out. So you can see my nose, my logo, and then my belt line or my tassels here, or drawstrings, are all in a line. If I'm here, it's kind of a curve this way, so I want to pull the shoulder away from my ear to straighten out here. Now we're in a strong core position. Lastly, we don't want the chest or ribs way out, so we want to pull those in as well. If your chest and ribs are way out, your low back is going to be excessively arched. We don't want that. All right, now that I'm in a good position here, simply just holding here is great for the shoulder and the side of the core here. It's already on just to hold me in this position. Okay, now that we have this, we're just gonna do a couple of these where we slouch and then recorrect, slouch in the shoulder and recorrect, just so we can really feel that motion so we know we have that shoulder locked and loaded in. Okay, now that I have it locked and loaded in, I'm gonna make sure my shoulder is not stuck forward. We're gonna pull that sucker back, okay? Good, now that I'm in really good position, we're gonna load the elbow a little bit more by going up into a high oblique sit like this, okay? So now we're getting some elbow load or elbow motion through the hand while holding really good stability at the shoulder and the torso. So now I have this position, I'm locked and loaded. I'm gonna simply flatten my hand completely flat, not weird stuff with the fingers or arching the hand, completely flat hand. And I'm gonna push the ground away from me, keeping that shoulder packed, and then straightening the elbow, and then slowly coming down. This looks really basic and simple. It's a lot harder than you think. So I wanna keep that shoulder loaded, slowly press up, pushing through and away in the arm, and then come back down. Good. Press that straight up. Good. And come back down. Perfect. Do that for about 10 reps or so, and we want to do this at least twice a day. So to put it all together with the 3 R's, we had the reset the joint, 20 repetitions, 5 times a day. Then we have restore soft tissue motion, once or twice for a couple minutes is fine. And then lastly, we want to do about 10 repetitions of this low to high oblique sit here, about 5 times a day. Perform this combination for the next 1 to 2 weeks, and then evaluate and see how is your pickle elbow doing. For most people, this will be very relieving and help your pickle elbow go away and stay away. However, if you're still having issues or it's been going on for quite a long time and unrelenting, it's a chronic issue that there may be some other things going on in your body that we can't address through a video. So I'd always highly recommend seeing a trusted professional in your area that can help you solve this problem so you can keep playing pickleball without your pickle elbow holding you back. All right, thanks for watching. For more content like this, make sure you click subscribe, hit the bell for reminders, and also check out these other videos. I'm not sure which side. These other videos for other content.